Anishinaabe Nation communities face a growing mental health crisis.
Today, the province announced more than $2 million in emergency funding to help First Nations respond to the frequent suicides and other tragedies that have a profound impact on mental health. Jonathan Wilson has the details.
In the past 2 months, crisis teams with NAN Hope have responded to 17 tragedies in 12 communities, including the sudden deaths of a number of young adults and children as young as 12. That's according to officials with Kiiwetinoong Ogamakanak, who operate the community-led mental health program.
There are so many crises that occur in our NAN communities. There has been a significant rise in the last 7 to 8 years. So the crisis response is essential.
NAN Hope is one of 4 programs receiving a total of $2.6 million in emergency funding from the province to address the severe mental health challenges faced in Anishinaabe communities. Indigenous Services Minister Greg Rickford was joined in Thunder Bay by Michael Tibolo, Associate Minister of Mental Health and Addictions, to announce the funding.
I've seen firsthand what the mental health and addictions crisis have done to Indigenous communities across the province, particularly in the north. I've spoken to the parents of children lost to suicide and to the children of absent parents lost to the terrible cycle of addiction.
Tibolo emphasizes the need for government to listen to First Nations and follow their lead in working to improve mental health outcomes for First Nations people. He and Rickford both say there will be more funding announcements to come for medium and long-term solutions.
We didn't come to this table empty-handed, and our solutions won't be empty platitudes and endless discussions. We know that what is required is action, and we're taking action because the status quo is unacceptable to absolutely everyone.
It's a clarion call for NAN, organizations like KO, and other levels of government to continue to work together and to commit not just to the delivery of targeted mental health and addiction services, but to also create a platform for economic prosperity.
$1 million of the emergency funding is going directly to KO to increase surge capacity for the NAN Hope program. The rest is supporting various NAN mental health and crisis response programs in communities and in urban centers. Parkinson says while this funding is greatly needed to address immediate needs, ultimately, she says underlying conditions need to be addressed.
We're responding to are being reactive to crisis as opposed to being proactive, but this is just kind of what we're faced with today.
Jonathan Wilson, TBT News.